Case Study Presentation by Taylor Wagner, Bio200. Karina J., 31-year-old female, came to the ED complaining of a hot, intensely painful sunburn-like rash around her vaginal surgical incisions from an episiotomy due to a breech baby. Patient complained of muscle aches, nausea, and fatigue, was diagnosed with cellulitis. 5 days later, she returned with continued pain and rash, but this time it was extremely hot and much more painful. The skin had turned red, purple, and black. Patient's vital signs were 113 beats per minute for her heart rate, BP of 81/64, respirations were 16, O2 was 97%, and she had a temp of 102.3 degrees Fahrenheit, and patient was starting to become mentally confused. An MRI was ordered along with CBC and a deep tissue culture of the fascia with a gram stain. The test results came back with the MRI presenting a thick, greater than 3 millimeter hyperintense signal in the deep fascia. CBC showed elevated levels of white blood count, and the deep tissue culture showed extensive superficial fascial necrosis with a gram stain that displayed clusters of gram-positive streptococcus. Does anyone have any guesses of what this disease might be? The test resulted in the discovery of Staphylococcus pyogenes, leading to the diagnosis of necrotizing fasciitis, commonly called flesh-eating disease. Signs and symptoms include redness, pain, and swelling, and may develop fever, nausea, malaise, and may become mentally confused due to a drop in the blood pressure. It's transmitted person to person following surgery, abortion, and any breaks in the skin. So you can get it from a bug bite even, or a needle stick. Necrotizing fasciitis is an aggressive inflammatory infection of the fascia, causing subcutaneous tissue necrosis, death in tissue. By producing toxins that affect tissues, it progresses along the fascia, developing painful, red, and necrotic tissue as it is deprived of its blood supply. This is a surgical emergency. Removal of tissue is needed, as this is a fast-developing and potentially fatal disease. This slide shows what the healthy skin looks like compared to necrotizing fasciitis skin. Surgical debridement was done to remove infected tissue. Intravenous broad-spectrum antimicrobial drugs were prescribed to slow the progression and inhibit any of the remaining bacteria. High-pressure, pure oxygen was used to inhibit bacterial growth. Patient breathes 100% oxygen to help manage infection by improving oxygen delivery to affected tissues. These meds were ensured safe for mom and baby, which is included down in the corner here. Vancomycin 1 gram by IV every 12 hours and linezolid orally every 12 hours. Wound dressing changes were required also. Immediate tissue coverage protected against superinfection as well as fluid and electrolyte loss, allowing Karina to mobilize and interact with her newborn early in the process, reducing any pain. A traditional reconstructive included a full-thickness skin graft. The patient healed properly and was able to return to her normal life with her healthy newborn and was able to continue the wish to breastfeed without any interferences from the medication she was prescribed. Here are my references that I used throughout the presentation and my project. Thank you.